I'm Peter Block at TCT 2018, and the whole issue of how to non-invasively or relatively minimally invasively reduce mitral regurgitation is a big topic here at TCT this year. With me is Horst Sievert from Frankfurt in Germany, and Horst has been one of the prime movers in percutaneous treatment of mitral regurgitation. So Horst, tell me about Reduce-Fmr, this study, a relatively small study, but an interesting one.
Small study, but actually the first sham-controlled study in valve therapy at all. And we enrolled 120 patients, randomized them 3-to-1 to Carilion device, which is an indirect coronary sinus approach, annuloplasty approach against best medical therapy.
Okay, so the Carilion business has been around for a long time. I remember we talked about this many years ago. It's been a while for this trial to finally come to fruition.
That's why it was so important to conduct this trial, because there had been some doubt whether it's worked or not. And it is working, as we have shown. And the problem with that device is there is, in some patients, not an immediate effect, it's a delayed effect. And that made it so difficult to assess whether it works or not.
So what's the mechanism behind that? You think it continues to constrict the annulus or the posterior myocardium? What's going on?
Good question. We actually don't know that, but it's a constriction on the annulus, which obviously needs some time to translate to the mitral valve.
And back to the usual question about Carilion, all patients are candidates, or do you really choose them carefully for where the CS is in relation to the mitral annulus?
We tried this initially before we entered this trial and did CT scans to look whether we can find patients which are better candidates than others. We didn't find it. There must be some relation, but we need more data to find that out.
Fair enough. So what did you find? Let's go back to what the endpoints are and what you found.
Endpoint was a mechanistic endpoint, so we're looking for a reduction in MR. Regurgitant volume was the parameter, and this was reduced by 22% in comparison to the sham control group. Actually, we saw some improvement in the device group and some worsening over time in the control group. And
so the regurgitant volume really does diminish 22%,
Yes.
25%. Yeah. That's not terrible.
Yeah.
Long term, what happens?
This was after 1 year, so we know from our other clinical experience that it's a long-lasting effect. We have follow-up up to 2-3 years with the other patients, but this trial was limited to 1 year.
Okay, so a device that's been around for a long time, something that a lot of people had some doubts about at the beginning. Now we have a sham-controlled trial, which tells us that, hey, wait a minute, maybe this does work. Yeah. So I asked you the question before, I'll ask it again. If you had MR and you were starting to get sick, would you like to have this device?
I prefer not to be sick and not to need it. But if I need a device, I most likely would start with that kind of device because it leaves all other options open. And if the effect is not sufficient, then I still can go for a mitral clip or something else. And I don't know what happens in 30 years, when I'm 30 years older. Maybe then I need a TMVR, which is obviously not possible with a mitral clip in place.
Okay, so an option that may give you further possibilities going forward, and maybe this device plus medical therapy will hold you from getting sick, as you don't want to become over time, to begin with at least.
Yeah.
Thanks, Horst.
Thank you.